between the head and the body, and it projects slightly forwards at the junction of the head and the body. Behind the neck there is the formation of the portal vein in the upper part, and in the lower part it is related to the superior mesenteric vein. Now neck has got anterior surface, posterior surface, upper border and the lower border. The anterior surface is covered by peritoneum, and it is related with the pyloric part of the stomach. And posterior surface is related to the portal vein, formation of the portal vein in the upper part and superior mesenteric vein in the lower part. Now this is the body of the pancreas, which extends from the front of the aorta up to the anterior aspect of the left kidney. It is triangular or on cross section. It is prismatic. So if you make a section, cross section here, it will be triangular. So body has got three presenting parts, three borders. So this is the upper border, this is the anterior border, and this is the inferior border. So three borders are there: inferior border, superior border and the anterior border. Three surfaces: this is the antero-superior or anterior surface, this is the antero-inferior or the inferior surface, and this is the posterior surface. How will you identify the posterior surface? By seeing the splenic vein. So this is the splenic vein. And how will you identify the upper border? By the presence of the tortuous splenic artery. So this is the tortuous splenic artery, by which you can identify the upper border. So the upper border of the body of the pancreas is related to this tortuous splenic artery. Anterior border gives attachment to the two layers of the transverse mesocolon, and in the inferior border at the right end there is emergence of the superior mesenteric vessels. Anterior surface or antero-superior surface, it is covered by the peritoneum of the lesser sac, and it is an important structure of the stomach bed. That means it is related to the posterior inferior surface of the stomach. Antero-inferior surface or the inferior surface, it is covered by the peritoneum of the greater sac, and it is related to the duodenojejunal flexure on the right side, left colic flexure on the left side, and in the middle part there are the coils of the jejunum. Posterior surface, this is the posterior surface. Posterior surface is related to the so many structures: the left crus of the diaphragm, the left psoas major muscle, the left sympathetic trunk, the left kidney, the left suprarenal gland. So many structures are there, and all these structures are separated by the splenic vein, which lies in a groove on the posterior surface. So this is the splenic vein, which is present in a groove on the posterior surface, and it separates all the structures which are related to the posterior surface of the body of the pancreas. Now tail of the pancreas, the junction of the body and tail, you can demarcate posteriorly by the attachment of the peritoneal and the non-peritoneal part. But anteriorly you cannot demarcate between the body, junction of the body and the tail. Tail is related with the spleen, posteriorly with the spleen, anteriorly with the body of the stomach, and below with the left colic flexion. Now the tail is related to the non-peritoneal triangular area on the spleen.